Good morning and welcome to the Thursday, June 11th COVID-19 briefing. Today I have with us our Chief Administrative Officer, Ryan Alsop, Matt Constantine, our Director of Public Health, and Georgiana Armstrong, our lead on the skilled nursing facilities, and Kim Hernandez, our lead epidemiologist. I'm going to start with our Director of Public Health, Matt Constantine.
Thank you, Megan. This morning, we are reporting 74 new COVID cases in our Kern County residents and no additional deaths. In our past meetings, I have talked a little bit about our skilled nursing facilities, some of the numbers at Kingston and Valley Convalescent. Those numbers for this morning are not reliable. We have different numbers coming in from different state resources. So I do not have an update today as they are trying to reconcile those numbers. It is important to note that the state is reporting, though, to us that 12 of the 19 skilled nursing facilities are now reporting positive employees to the state. So 12 of the 19. And that's a little bit of a concern for us as that presents some risks to the residents within those sites. Our skilled nursing facility testing program still remains active. This week we were at Parkview, Julian, and Rosewood. Tomorrow we are at Valley View Care in Delano. And since May 15th, we've tested 1,198 employees. So that's 13 of the 19 skilled nursing facilities we've tested. And then last Friday, as we have discussed, around 4 o'clock in the afternoon, the state did release industry sector guidance documents that allowed us now in stage 3 to open up 13 different areas. In fact, it was 12 on Friday, and then I think a couple days ago the movie theater guidance document was released. So 13 have been released. We are working with those industries. We've put all those guidance documents on our website. Our expectation, of course, is when these businesses open up, they adhere to those guidance documents to make sure that we're all protected. And then finally, the state has been working on some new modeling software. We've been on a few phone calls with the state. Our hope is next week, hopefully Monday, we'll have an ability to talk more about the state model for Kern County and where they see some of our numbers going. But we'll deal with that next week. With that, I think I'm going to ask Georgiana Armstrong to come up and talk about skilled nursing facilities.
Good morning. On June 2nd, the Board of Supervisors designated a new task. They designated me as the lead. However, it is important to know that the Kern Emergency Operations Center is active, and so this project, this expanded oversight with the skilled nursing facilities, is being run through the EOC with that structure. Some of the actions we have taken so far: we have expanded the list of daily conference calls to skilled nursing facilities, basically on a watch list. We are currently having a conference call with them daily for 7 of these facilities. We expect that list will expand as we get information on additional facilities with COVID-positive residents and or staff. And by daily, I mean 7 days a week, not Monday through Friday. The California Department of Public Health has issued a requirement to these facilities to submit a mitigation plan specific to COVID, and those plans were due to the state on June 1st. The state has agreed to provide copies of those plans to the county after they are reviewed by the state, the initial review. And to date, we have received 6 plans for 6 facilities. We are currently reviewing those mitigation plans to understand how they intend to implement the appropriate procedures to protect residents and staff. Part of the state project will include an on-site visit to these facilities on a 6 to 8 week schedule. We believe a more frequent schedule will be of benefit to identifying problems early and taking corrective action early. So we have pulled together a site inspection or site visit team made of public health staff. We have developed a checklist that will support those site visits that ties to the regulations and the guidance issued by the state through multiple documents that they have released. If we find issues that are of concern, we will advise the facility. We will provide support to help them meet the requirement as needed and or take corrective action as required. We are also reviewing the information released by the state, and one of the components that I have not seen to date that is very common in emergency management is the use of checklists and job aid tools. So one of the things that we are doing at the EOC is to evaluate the state information and to develop those tools for the SNFs, because our overall goal is to partner with them to help them do what they need to do, because that is what our community is relying on them to do. Thank you.
Thank you, Georgiana. Really quickly, I'm going to go through our testing sites. We do have some changes, and I want to explain those. Right now, we have tested over 7,000 individuals as of yesterday. We currently have the following state-funded sites. There is a facility at the Kern County Fairgrounds in the Harvest Building, as well as a drive-through location at Gate 26, which if you've been to the fair, it's down where the rides used to be. So there are 2 locations there now currently, however, that will change. There is also a location at the Arvin Public Health Building and the Mojave Veterans Hall. Quick explanation on the changes related to these state-funded sites. These sites actually have a use requirement. The state monitors them, and if they are not being used well enough, and we have partners in other counties who have well-used sites or are exceeding their capacity, we have a responsibility to move these sites around to make sure that we are ensuring that every citizen has access to testing. So that's why you're starting to see some of these move, to make sure that we're putting them where the highest need is. Our county-funded sites remain in Oildale, Taft, Delano, Kern River Valley, Ridgecrest, and Tehachapi. Opening next week, we hope to see one in Lamont. And as now that we have 2 sites at the fairgrounds, we will eventually relocate the walk-up site out to the Wasco area. So again, we'll provide those addresses as we have contracts that have been finalized. If you want more information about those, you can find them on our website at kerncounty.com. There's a big button on the front that says COVID-19 testing. And with that, I'm going to turn this over to our Chief Administrative Officer, Ryan Alsop.
Thanks, Megan. Good morning, everybody. Today, we've tested in Kern County 36,000 residents for COVID-19. 32,000 or 90% of those tests have come back negative. We're seeking the results on 768 or 2% of those tested. And we've got 3,016 residents, or about 8% of the total number of people tested who have tested positive. Of the 3,016 residents who've tested positive today, 2,902 or 96% of those are either fully recovered or are recovering at home, treating their symptoms on their own. Today, 63 of our residents, or 2% of those who've tested positive, are receiving some form of care in an area hospital, and unfortunately 51 or 2% of those who've tested positive have passed away. Over half of the deaths in Kern County, our total number of deaths, over half of them are attributed to at least 3 different state-regulated skilled nursing facilities. These are the facilities that Gio was just discussing with you all. A couple of updates on our Kern Recovers program. This is a program to get Kern back to business. There are a couple of components. One has been ongoing for the past couple of weeks. It's a forgivable loan program where we're targeting small businesses that qualify in the community. These are businesses that have been listed as non-essential by the governor, that have been severely impacted through this endeavor, this COVID endeavor. And we've been targeting them the last 2 weeks. We have provided nearly $2 million in financial assistance to businesses all across Kern County to date. There are a number of loans, a number of different applications that have been funded. Next week, we'll begin to transition doing both the non-essential and essential businesses that have been impacted by COVID-19 in this community. We are still prioritizing those who have not received federal assistance yet. So if you've received PPP, that would not qualify you yet to receive this assistance, but there may be a time down the road where we go into a phase where this assistance may be available to you. So next week, getting into funding, again, essential businesses that have been impacted by COVID, in addition to the non-essential businesses. For information on this, you can go to kerncounty.com. I would please ask all small businesses in our community to go to our website and take advantage of this opportunity to receive financial assistance. Most of our loans, the average amount is about $22,000 to date, and we will be keeping you informed on the progress of that loan program. We'll actually be putting up next week some data metrics where the community can follow along in fairly great detail where this money's going, when it's going, how much is going out, et cetera. So look for that. In addition to the loan program on Kern Recovers, we will be talking to the board next week at the board meeting on Tuesday about a PPE, a personal protection equipment, protective equipment distribution program utilizing the county's purchasing power, buying PPE supplies. These are things like hand sanitation, hand sanitizers, other sanitation equipment, masks, et cetera, where we would be distributing this equipment to Kern County small businesses. This is a $5 million program made possible through the Federal CARES Act. We're targeting 5,000. Our goal is 5,000 independent small businesses in this county. We're going to have a number of distribution points throughout the county where businesses can go get a 2-week supply. Once that 2-week supply is used up, they can come back and get another supply while supplies and money lasts on that. We'll be rolling that program out. We'll be discussing that with the board next week, so look for that program in the days ahead, and there'll be information on kerncounty.com for this program as well. Lastly, I wanted to talk a little bit about the state and how the California Department of Public Health is monitoring counties. Businesses are reopening all around the state, and they're reopening here in Kern County. And whether you've been an essential business for the past several months, or you've been a business that's been ordered to close by the state, but you're now allowed to begin reopening, all businesses that are allowed to reopen and operate right now must be doing so with adaptations and be doing so under state public health guidelines. We must have sustained adherence to these guidelines. As we reopen, the state is monitoring and working with all 58 counties daily, including our county, across a number of metrics. These key metrics are disease transmission rates, hospitalization rates, and hospital capacity. So it's the readiness to serve patients in our area hospitals, both for COVID-19 and any other need for hospitalization in our community, whether it's a car accident, a heart attack, you get the picture. Here in Kern, and not unlike other counties in the state, we are seeing elevated transmission of COVID-19, along with elevated hospitalization rates. These trends, if they continue, may impact how we continue to reopen locally. Again, we are not alone. There are many, many other counties in this state. There are many, many other counties in other states that are dealing with these elevated transmission rates, elevated hospitalization rates. We're working closely with the state to continue monitoring these areas in a targeted way so that we understand why these trends are happening and what needs to be done to address them. We continue to reopen, but it needs to be done carefully. Again, at the end of the day, and I've said it several times, this is the ability for our hospitals to manage the medical needs of this community, COVID-related or unrelated, particularly those requiring intensive care, that capacity needs to be maintained. If it is not, we have a significant problem. So that, at the end of the day, is what this is all about, and we need to maintain our ability to treat patients in our hospitals. So again, and lastly, before we answer questions, whether you're a business owner or not, all residents of this county, please continue to adhere to public health guidance as you go about your lives, as you go about reopening businesses, as you go about going to those businesses, in and around your friends. Please use best practices and adhere to guidance for this period of time. It's very, very important. That is the biggest help that you can provide us as a county, our hospitals, in managing our ability to treat patients. And we thank you in advance for your vigilance.
Thank you, Ryan. We'll get ready to take questions now. As always, we'll go in the order that was provided to you this morning. Before we start that, I want to make sure that we pause for a moment and thank our ASL interpreters. They're here every week. They're with the Independent Living Center here in Kern County, and so a big thank you to our interpreters. They're working really well to keep up with us. So our first outlet is Kern Soul. Remember to use *6 to unmute your phone.
Hi, this is Elizabeth from Kern Soul. My question is about the county, or the county data monitoring chart by the California Department of Public Health. Ryan touched on this a little bit. I do have a follow-up question. So the data showing that, we're not meeting a couple of these benchmarks that the state has set in place, but what's going to be the turning point for the state is there like a certain number we have to hit for them to say, okay, you have to stop reopening? What will that look like? And is there like a certain, do we have a deadline or where we need to go back to meeting the benchmarks? Does that make sense?
It does. Let me have our Director of Public Health, Matt Constantine, answer that for you.
Good morning. And I'm bringing my laptop up front because the numbers have just been updated on the state's monitoring website. And your question is a good question, and it's the same questions that we have. I've been talking to the state for the last few days, over the weekend especially, about the state's approach to the monitoring program and what we're going to do together if we don't meet some of these state metrics. So we have some calls scheduled with the state to talk about drivers behind some of those numbers. And as Georgiana has mentioned, the skilled nursing facilities continue to cause some concern for us, not only for how they are impacting our hospitalization rates and our resources in the hospital now, but also in the future. As we've seen additional skilled nursing facilities start to suffer some of the consequences of COVID-19, we want to make sure that we're doing everything, and the state's doing everything they can to help manage the numbers. So it's a process that we and all the other counties that don't meet the standards go through. We will come on and off that monitoring program routinely as they look at the numbers on a daily basis. But our hope is to engage in a conversation. We have talked a little bit about are there hospitalizations that are being transferred in from out of county? Are state prisons potentially impacting our numbers? So these are discussion points that we'll have as we try to figure out how we can keep our disease transmission rates low. Hopefully that answers your question.
Thank you.
Okay, our next outlet is the Mojave Desert News. Anybody on the line?
Hi, this is John Bennett from Mojave Desert News.
Hi, go ahead.
I just wanted to clarify something you said, or ask you to clarify something you said earlier. You said 7,000 total tests. That was just for the state sites, is that correct? Or
Yeah, that is the state and county sites combined. Since they started operation, the first one opened on May 4th. So since May 4th, the state and county sites combined have conducted just over 7,000 tests.
Okay, and then another question I had was, I know we have at least one, I guess what you would call private provider in East Kern that's doing testing, Sparts, Altadena. How does that work with the reporting to you folks, and how does it get recorded?
So that's a question for our public health director. Let me have him answer that.
So there are a mixture of what we call originally county-sponsored and privately sponsored sites, along with our clinics and our hospitals in the county that provide testing. All of that, all those results are required to be reported to public health, and we review those, of course. If there's positives, we make contacts with those cases, and we talk about potential exposures that they have had. So there's a whole process we follow, but they're under the same obligation that anybody else is to report those positives to us.
Okay, great. Thanks very much.
Okay, our next outlet is Channel 29. Anyone on the line?
Hey guys, this is Tim from Channel 29. We were talking about the accelerating cases and the hospitalizations going up. I was wondering, what's the rate of ICU when they're in the hospital versus someone who's in a normal hospital bed? And how close are we, or are we prepared if there's more of a surge to treat those folks if they need ICU attention?
Tim, can you do me a favor and explain the first part of the question a little bit more clearly?
Sure. So I just was wondering the ratio or the percentage of folks who are in hospital but in an ICU unit versus folks who are in hospital but in like a regular hospital, bed.
Okay, great, thank you. We're going to have our lead epidemiologist, Kim Hernandez, respond to your question. Or, I'm
Sure,
sorry.
Thank you.
Matt or Kim is going to answer it.
Sure, thanks.
Hi, Tim. Overall, we haven't been publishing on a daily basis our case status of patients in the ICU. Overall, we've had about 3% of all of our cases have needed ICU care at one point in time. We're running at about a 10% overall hospitalization rate, so hopefully that will give you the comparison you're looking for.
Okay. So in terms of capacity then, our ICU capacity is still looking pretty good.
I'm gonna let Matt or Kim answer that one before I nod in response.
Yes, so capacity, hospital beds, ICU capacity is what we have always been concerned about. That is the whole premise behind flattening the curve, to make sure we have the resources available to handle all of those that would potentially get sick. And although the percent that are hospitalized is low and the percent that end up in an intensive care unit is low, we need to make sure we have that capacity. So that is a metric that we monitor. It's one that the state monitors. It's on one of their items that they check off. For now, we are okay, but we are concerned in the future if cases increase, we need to make sure we have that capacity. It's something that we carefully monitor.
Right. Awesome. And my final question is, Mr. Alsop was talking about how he's really imploring everyone in the county to maintain public health guidelines and for businesses to follow the guidelines so that they can reopen. Are we monitoring different businesses that they are following these steps, or is it still kind of not so much of a stick enforcement, so to speak, and we're just kind of, encouraging them to follow the guidelines? Or as the numbers accelerate, are we going to have more of an actual enforcement?
Okay, thanks, Tim. I think Matt's going to answer that question as well.
So the guidance documents that have been released are very well thought out. They're very detailed, and it's designed to prevent disease transmission. We need to do everything we can, both as a member of society and as a customer and as a business owner, to do everything we can to protect ourselves, our coworkers, and our family and our friends. So We are encouraging everybody to strongly follow those. Oftentimes, I mean, these are new practices. These are new procedures. It's unfamiliar for us to wear masks all the time and keep our distance from each other. That's not normal for us. So it's going to take some training. We'd ask everybody to do everything they can. If you have family members that aren't adhering to those recommendations on social distancing, we'd ask that you help. Reemphasize the need for it. If you see employees at a business that could use some assistance or some guidance, we'd ask that you provide that. We get a lot of calls for businesses asking for information. As I was sitting here, there were questions coming in about restaurant businesses and about masking. So there's a whole list of different types of conditions that we get into, and we're trying to use logic to apply those guidance documents so that we reduce that risk of transmission and keep our disease rates down. But right now, it's just a lot of educating the public and educating businesses, and everybody wants to follow the rules. It's just a little bit confusing now, and we have to kind of reason some of those out. So together, we're going to get through this, and we're going to just continue to emphasize the need to take those actions seriously.
Okay, but there's not going to be like a formal enforcement per se.
So public health and the county as a whole is not enforcing. There hasn't been a need for that. Our public health's role from day one has been education and awareness, reinforcing those state rules, and providing the reasons behind it. And we have found that the far majority of people just want to understand why and then want to do everything they can to help.
Awesome. Thank you, guys.
Your next outlet is Channel 17. Anyone on the line with questions?
Yes, hi, it's Eitan with Channel 17. I think I'll begin with Ryan. I think I'll have a follow-up for Ms. Armstrong. But first, I'll just ask Ryan. I know he said that here in Kern, not unlike other counties, we are seeing elevated transmission of COVID-19 as well as elevated hospitalization rates, what Ryan just said. Specifically, and I know that Kern Soul also touched on this, but do we have specific daily, average per day numbers now that you can compare, let's say, to 2 weeks ago? In other words, are there specifics that I can compare to from a few weeks back?
Thanks, Eitan. I believe that possibly Public Health has some of the data. Give me 1 second to figure out how to respond best to that. Sorry for the delay, Eitan. We're going to have Kim Hernandez respond to your question. We just had to actually get the answer for you.
Thank you so much.
So we said, it was mentioned several weeks ago that we were having 30 to 40 new cases a day. Ms. Kerrigan mentioned on Monday that we are now seeing closer to 50 to 60 new cases a day. So we have seen an increase in the number of cases per day that are getting reported out to us. And so I don't think that, that's something we continue to monitor, and we're going to continue to watch as that goes up for the immediate future.
Thank you, Kim. Appreciate that. That's very helpful. Now towards Ms. Armstrong, I just wanted to clarify, just to make sure I understood. You mentioned you're going to have the county team have an on-site visit team made up of public health staff. Is this going to visit every facility or just certain facilities?
Thank you for your question. Our goal is to visit every skilled nursing facility in Kern County and to provide an outside pair of eyes to help them identify areas for improvement and make sure that they are in compliance with the state guidance. We will prioritize our visits starting with those that are at the highest risk, but we will be visiting every skilled nursing facility.
Excellent. Thank you, Ms. Armstrong. And final question, Megan, is for Ryan or whoever, Megan, you deem appropriate. We saw positive numbers out of the federal government, the economy, 2 million jobs, at least 2 million added, we recently heard. As far as you here, how are things locally? Is there anything you can share locally that you've heard about the economy improving?
Definitely a Ryan Alsop question, so we'll have him answer that.
Mm-hmm.
Eitan, I don't know specifically how to answer your question other than just to say no in general. The economy is, if you want to talk about how businesses are reopening, businesses are expanding operations and getting back to having customers in, and I would say that's an improvement, and we'll see the benefit of that over time. But in general, the economy is not good. Unemployment is not good. It's very, very high in this county, and we've had many folks lose their jobs. Many folks apply for, tens of thousands of people apply for unemployment benefits, and certainly when it comes to revenues to the county, when you throw in oil, and you throw in an event like this that has an effect on the overall economy. As the economy goes, so does government revenues. When you throw in the fact that the state has announced a $54 billion budget deficit and cuts that they're planning to make, overall it's not good. So hopefully that answers your question. I hope to see improvement. This is why we need to, this virus is here. It's going to remain here. It's going to continue to spread in our community in the months ahead. And we need to understand that, be aware of that, be hyper-vigilant about that while we reopen and while we get our businesses functioning again. That's a balance that we are going to have to undertake. And that's why we continue to say follow the guidance. If you were following the guidance, if you're a business, if you're an individual going to that business, or if you're an individual doing any other thing, follow public health best practices, continue to do that. That's the very best thing that we could be doing in order to manage the spread of this. And again, at the end of the day, this is all about hospitalization rates and then capacity to make sure we have enough hospital capacity. So economy, not good, but we'd like to see it improve as quickly as possible.
Thank you.
Eitan, just so you know, we may have some job-specific numbers available to you. I'd have to pull those afterwards. If you want to connect with me, then I can kind of help you walk through those. Our next outlet is KNZR. Anyone on the line? KUZZ? Anyone on the line? Bakersfield, Californian. Okay, this is the part where I have to remind people, *6, just in case. Kern Radio.
Stacey from the Californian. Can you hear me?
We can now.
Sorry, it took me a second to unmute myself. My question is probably for Ryan or Matt. I wonder, now that we're in this targeted engagement process, are all of the businesses that guidance has been put out for allowed to reopen in the county at this point?
Yes, so we made the announcement on Friday of last week that effective immediately, the 12 sectors that the governor released on that day were allowed to operate immediately.
And did I hear that some more guidance documents were put out this week?
Yes, there was an additional guidance document put out for movie theaters that was not released with the batch on Friday.
And so can movie theaters reopen here?
Correct. With the guidance. They can all reopen as long as they adhere to the guidance.
Okay. And so I guess my question is, what is the message to the public about, what part it can play in helping to prevent the disease spread, the virus spread, now that, we have a concern with the elevated transmission in our county.
Right, Stacey, I think Ryan addressed that earlier. I'm going to have him come back and kind of restate what he said earlier.
It's very important that all residents in Kern County, all businesses that are reopening in Kern County, follow public health guidance. The guidance has been made available by the California Department of Public Health for industry. It is fairly thoughtful and thorough. There are a set of directives in addition to sets of considerations, recommendations. Those guidelines need to be followed. If you are not a business owner and you are somebody that is going to go out to eat or go get your hair cut, it's very important that you follow the instructions and guidance being given to you by the establishment that you're visiting. In any other area, again, please wash your hands regularly. Please don't touch your face, your eyes, your nose, your mouth. Don't touch surfaces that are frequently touched by lots of different people. If you need to be cleaning surfaces on a regular basis, you shouldn't be touching surfaces and then rubbing your eyes. That is the quickest way to be exposed and to be infected by this virus. If you cannot distance, if you cannot avoid a crowd of people, particularly people that you're unfamiliar with, you should be wearing a mask when you're up close and personal for a sustained period of time. The recommendation is to wear a mask when you cannot social distance. Continue to be smart. Continue to be aware that this virus is here. It will remain in our community for months. It will spread in our community for months. And it's important that everybody understand that. It is not going away next week, or it's not going away next month. It's the opposite. It's actually going to be here and continue to spread. So you can protect yourself and protect others and help us manage the spread of this and slow it and help avoid overwhelming our hospitals by doing all the things that I just walked through.
And just a really quick follow-up, thanks for that answer. Is the county going to be doing anything different or asking businesses or any sectors in the community to do anything different as a result of the targeted engagement that it's now in with the state?
So we're in targeted engagement. We're talking with the state as several other counties have been for weeks and weeks. We're going to continue to have those discussions, figuring out, why we're seeing trends we're seeing and how to address them. We may very well, at some point in the future, need to recalculate, reconsider, figure out locally if we are not able to address those trends, if we are unsuccessful in addressing and stopping upward trends in any one of those data areas, we may have to act locally in some way to pull back. That doesn't mean we close everything down necessarily, but it's we've got to consider. We're going to have to be open to considering actions that we may need to take if we are unsuccessful in getting those any upward trends in these criteria under control. And so that's what this targeted engagement and discussion is about. And really, we won't know until we get to a point where we're just not seeing any success in what we're doing, and we'll have to pivot.
Okay.
Thank you.
Thank you.
Just a quick reminder for all of those who are watching, if you are interested in the guidance documents, they're available on our public health website as well as the county's website, and we would encourage you to go check them out. They're a little lengthy, but once you've read a few of them, you kind of get the rhythm. So right at the top bar of the county's website, there's a link to them as well as on the COVID page for Kern Public Health. Our next outlet is Kern Radio. Anyone on the line?
Good morning, it's Ralph Bailey.
Go ahead.
Why aren't law officers, police officers wearing masks. There was an accident on my street the other day, and none of the 6 officers were wearing masks. They were interviewing witnesses. One of the officers, just trying to do his job, helped one of the injured off the curb. They were linked arm to arm. They were literally damn near cheek to cheek. Have you all talked to Sheriff Youngblood or Chief Terry about their policy?
Not to my knowledge. I would encourage you to ask either the Kern County Sheriff or the Chief of Police from Bakersfield Police Department about that.
Okay. And can I go back to another question I had earlier in the week? They've linked blood type to the disease. Talked about earlier this week that people with A blood type like me are 50% more likely to get on a ventilator. They're now saying type O is least likely to be severely ill. Is there any intention by the department to either tell hospitals or to monitor this thing by blood type?
So I believe our lead epidemiologist, Kim Hernandez, is going to respond to that. Give us just 1 second.
That's a great question, Ralph. We know that actually in late April, information coming out of China identified a possibility that people with blood type O may be less likely to have severe illness. That's something that has been looked into, as well as more recent reports about patients with blood type A and whether or not those are truly protective or risk factors for those patients. That's something we have heard from CDC they continue to look into. There has been no specific guidance from CDC at this time regarding blood types, but we do know that that information has been circulating among clinicians, and it's something that they're continuing to look into. Thank you.
Thank you.
Okay, our last outlet is Channel 23. Anyone on the line?
Yeah, this is Tori Cooper with Channel 23.
Go ahead.
All right. So I do have a question about the Windsor Care Facility. Do you guys have any data that supports that there have been employees or anyone else test positive there?
I think there may be data available. I don't know that we have it at our fingertips right now. Tori, is that something that we could get back to you with afterwards?
Yeah, definitely.
Okay.
And so my next question is about the curve. So essentially, Mr. Olsop was talking about the fact that we are dealing with this, this increased situation. But a few weeks back, I know it was too soon to say whether or not we are actually slowing the curve still. I mean, even if we have more cases, the average is going up. Is our curve essentially going up too then, and we're not actually slowing the spread anymore? And is that something that the county is looking at?
Okay, so I think if I'm summarizing, there was a little bit of cutting out on your phone line, so I just want to make sure I captured your question correctly. You're questioning whether or not the curve is also going up with the number of positive cases that we're getting?
Yeah, essentially, is it safe to say we are no longer, slowing the spread in a sense of, the curve? Like, what does our curve look like? I mean, it sounds like it's going up.
We're going to have Matt try and answer your question.
Tori, good morning. I wanted to answer your first question. We do show that Windsor in Arvin and Windsor in Bakersfield, both skilled nursing facilities, they're reporting to the state, and the state's reporting to us that there's positive healthcare workers at both sites. The data I show is less than 11. That's how they report it to us. So I don't have an actual number, but they are showing positive employees on this state-provided database as it stands now. And then, Tori, on the other question about, I was looking up the Windsor question, but I think you were asking about modeling and where we're going. As I mentioned earlier, my hope is next week, hopefully Monday, to bring together some of the state modeling that they have given to us as it relates to Kern, so that we can try to answer that question. In general terms, the models that the state have shared with us shows that our cases will continue to increase, our hospitalizations are projected to increase, and our ICU cases will continue to increase. That's not anything unexpected. What we are always worried about is how much will it increase and over what period of time. So I'll have better information for you on Monday. We should be able to talk about that a little bit more. So I'm hopeful that that answers your questions.
Yeah, I feel like everybody else, all the other reporters in the room have pretty much touched on the other questions that I had. The only thing that I had to follow up was so we've kind of been dancing around this conversation a little bit about, enforcement versus encouragement. And, basically you guys have not really given us a clear threshold on when it would pretty much depending on the question.
Tori, if you could mute the feed that you have in the background, it's creating some feedback here in the room.
There's something going on. Can you hear me now?
Yes.
Okay. So essentially, if I was watching this, I don't necessarily know if I would have the clear indication and the answer to at what point are we going to have those conversations and the discussions. I mean, you guys have said, yes, we know it's going up, but is there, again, it goes back to, KBAK's question about what is that threshold? Do we have that threshold?
I think Ryan's going to try and respond to your question.
So the state has provided a number of data points that they're monitoring counties for, and I described some of those. Those key metrics are disease transmission rates, hospitalization rates, and hospital capacity. There are thresholds within those guidelines that they're monitoring counties by, and as we begin to see trends in any one of those areas that are upward and potentially violate or go over any of those thresholds, we get in discussions with the state to have targeted conversations about what's driving those trends and how we address those trends so that they can be addressed and so that we can continue to reopen. And that is the hope. To the extent that we're not able to successfully address upward trends, and if we're seeing that it continues to go up and up and up, and we're not able to contain it, then that would force us locally to figure out other options. But let me be clear, because it sounds like that you may not be clear, and we haven't been dancing around it. We are not enforcing. We are not going out and writing, arresting people, and we're not.
Clear.
You said we were.
I understand that.
Yeah, I thought you said we were dancing around the issue of enforcement. I just wanted to be clear. I'll just be really clear, which may be rare for a government official to be clear, but we are not going out and arresting people. We are not going out and writing tickets. We are not going out and strong-arming folks, the businesses in our community. What we are doing and what we have been doing is we are going out in a fairly frequent capacity, whether it's in person or by phone or through letter or email. We are engaging with various industries around the county to ensure that we have a continuity of understanding on what the guidance is on reopening. We have a continuity of communications on all that, so everybody is clear. And we are we're continuing to reinforce what the state public health officials are telling us and directing us to do with regard to reopening. That has been working well, as Matt has said. There have been some outliers on that, and where we have outliers and we have people that may be not following certain guidance, they're targeted. We go out, we continue to reinforce, they adjust, they make corrections, and that's how it's been working. And we're going to continue to stay in that mode for the period of time until we feel like that effort has been exhausted, and we're seeing diminishing marginal utility in that effort, and we need to do something else. So that's kind of where we are, and I hope that's very clear.
Okay, that
Okay.
concludes our last outlet. I'm going to pause and see if there are any outlets that have remaining questions.
I would say I have one last question.
Go
And
ahead.
it's just because, if that's okay, there's no one else.
Nope, go ahead.
Okay, so previously I was in this meeting and Mr. Olsop was mentioning the fact that he was mentioning about the flu deaths. And so I'm wondering if the county is still looking at the comparison and the rate in terms of the flu season. I know that we sent some questions to Michelle Corson about, flu season runs from October 1st to April 1st. And when I got to the state, they were working on getting those numbers, and it was essentially, at that point in time, it was 25 COVID deaths, 20 flu deaths. And we had our first COVID case in the U.S., around the same time in terms of a 7-month period. So I'm wondering if our Kern County public health officials are looking at the rate of COVID and the flu spreading in our community, and whether or not they're seeing any trends. And this may be a question for our epidemiologist, but whether or not there's any similarities now that we've been involved in COVID now for several months, if there's any indication to show that there are similar trends between the two.
We'll have Kim respond to your request.
Our current number of deaths due to influenza, as reported to us by the state, remains at 20. We do know that there are similarities between COVID-19 and influenza, particularly that it is passed, through respiratory secretions, and it is passed person to person. We know that those are some similarities. There is still continuing to be a lot learned about COVID-19, and so we want to be careful about those comparisons as we identify more information about it. Obviously, as you know, our deaths due to COVID-19 at this point in time is at 51, and so it is significantly higher than the number of deaths we have attributed to flu. A number of things have happened during the flu season, including discussions with clinicians about decreased testing of influenza while people were very focused on COVID-19. So we don't know if that plays a role in it. 20 deaths due to flu is still a large number. If you look back on some of our previous flu seasons, this is on the higher spectrum. However, this flu season was the first year we received our flu numbers from the state, and so those deaths included deaths in people of all ages. Prior to that, what was reportable for flu to the health department was persons under the age of 65. And so we want to make sure that that's a clear message as we're trying to compare this year's flu data to historical flu data, as well as trying to compare flu data to COVID-19. Thank you.
Thank you.
Okay, that concludes our Thursday morning briefing on COVID-19, and we will see you all next week.